Hello, welcome to Prime Aesthetics YouTube channel. So today I'm talking about microneedling. Microneedling is delivered in two forms of treatment. You have the derma pen and the derma roller. Essentially, what these treatments involve is creating microchannels on the skin in order to cause trauma. So it's actually triggering the skin's own natural healing process. So when the skin starts to heal itself, what it essentially is doing is creating new collagen and new skin tissue. So you have new, brighter skin. Well, it stimulates collagen, it stimulates new tissue, it works on scarring, it works on large pores, it works on lines and wrinkles, generally just skin texture and tone. So it's amazing just to brighten the skin, acne scarring, stretch marks. It can be used for deep lines, wrinkles, open pores, skin texture and tone, even out the brightness of the skin. There's so many benefits. It can be used for hydration, depending on the serums that you use. Because depending on the mesotherapy and cocktails of serums that we use, that's what we're aiming for. So we can tighten the skin, we can work on hydration, we can work on lines and wrinkles. So then we determine on what serums we'll be using, what face masks. The derma pen, which I mentioned, is an electronic device. So it has 12 needles on the head and it vibrates while the therapist is moving it up and down the face. So you've got one here. So we can adjust the depth of the needles from 0.2 right up to 2. We can go right up to the orbital eye, work along here, literally all over. So then we have the derma roller, which is a roller like this. Again, the rollers come with different lengths of titanium needles, and this is rolled up and down the face. I know you can buy these online, so please be careful because you can actually scar the face if they're not done correctly. They have to be rolled and lifted off the face in a particular way. You are causing trauma to the skin, and if you do it in not the right way, you can scar the skin. So essentially, they're your two treatments. So you can adapt the depth of microchannels that you're creating depending on what you're trying to achieve. Well, first, with all clients, we have a skin consultation just to find out what their main concerns and goals are, so we can reach their expectations and we can adapt the treatment with the serums that we use in order to meet that. So what we do is we tend to double cleanse just to make sure the skin is clean from any makeup, oil, debris that sits on the skin. We can do add-ons with these treatments as well. So if you want the painless peel, which is great, they really boost your treatment. Generally, then we would then use an alcohol to wipe the face, just to sterilize the face, because we are causing trauma and we are puncturing the skin. So we would do that, and we would then put the serums or the mesotherapy cocktails that we're using all over the face. We then start the treatment with the microneedling. So as we're puncturing the hole, the serums will seep into the skin and reach the deep depth layers of the dermis and epidermis, depending on the depth that we're going. So essentially what we're doing is we're delivering the serums directly into the skin. So after we've gone over the face twice with the needles or the dermapen, we will put on a mask. So again, we can pick the specific mask for what we're trying to achieve, whether it's hydration, if we want tightness, if we want, if we're working on anti-aging. So we would put the mask on so that we have a really, it's completely soaked, this mask, so it's really hydrated. We put the mask on, leave that on for 25-30 minutes to really sink through the micro channels that we've created, and it really is quite soothing after the treatment. You feel slightly sunburnt, not painful, just a little bit uncomfortable, but it's fine. But this part is really quite relaxing, so we just let all that sink in. So again, once that's done, we can finish off with LED light, but essentially always with SPF. Zinc SPF is great because it's really calming and soothing. So that would be the end of the treatment. It all depends on the depth that we want to go. So it would start from 0.2 up to 2 mils. So again, if it's really deep lines, we would go more sort of near the 1, the 2 mils. If it's general rejuvenation, it would be 0.2, 0.5. So it depends. If you're going this end, then more probably we would do numbing cream before the treatment. But generally, if it's general rejuvenation, we're only going quite surface layer, you wouldn't need any. It would just feel quite scratchy. Really, you'll leave feeling slightly sore and sunburnt, but generally it's 1 to 3 days. Thank you for listening.